This is Wellspring, presented by Spectrum Health Zeeland Community Hospital on 1450 WHTC and the new 99.7 FM.
And it's time to say good morning to Sarah Dunkersloot this morning.
And good morning to you, Ed. And good morning to those of you who are listening. And welcome to Wellspring, a live broadcast sponsored by Spectrum Health Zeeland Community Hospital. You know, there's nothing nicer than a beautiful smile and nice, healthy teeth. This morning, my guest is Dr. Brad Dykstra, a dentist from Hudsonville. February is National Children's Dental Health Month. Dr. Dykstra is here not only to talk about dental health for children, but for adults too. Good morning, Dr. Dykstra.
Good morning, sir.
Okay, so tell us a little bit about yourself. I always ask everybody the question, how did they decide that they wanted the career that they are in?
Well, the real short word is providence, but the longer version is I grew up on a farm in Newark, Michigan. My father always said, get an education so you don't have to work as hard as I did. So I went to Calvin College. While I was there, I decided I wanted to go into the health field because I wanted to be able to help people. And I sort of looked at medicine, I looked at dentistry, and also when I was in high school, I had this cool orthodontist that had all these nice ladies doing all his work for him. I thought that looked pretty interesting, so that's what planted that seed. But again, doors open, doors closed. I was able to attend University of Michigan Dental School. I graduated. It'll be 40 years ago this summer, and I moved to Hudsonville, started a practice from scratch, and I had a great journey.
So what do you enjoy about your work?
What I enjoy about my work is the people. Dentistry is dentistry. After almost 40 years, that part is pretty straightforward, but being able to interact with people, to be able to improve their overall health by improving their oral health, to change in a sense, their personality sometimes by giving them the ability to smile with confidence, which they didn't have before. They would always be embarrassed, cover their mouths, and really it can change people's lives. And also some of the patients I've been seeing for 30, 40 years, and they become like family. And so relationships still is what I love the most.
That's the trump card.
That the relationships with the people is a trump card. And also I love meeting new people, and we have in our office, we like to take a few minutes to get to know the person, like who they are, before we jump into why they're there or their dental things. And it's amazing with most people within 30 seconds to 2 minutes, just by talking a little bit, we can create a connection. Like just an example, and we have an office in Grand Rapids, and I was filling in there the other week. This one lady was in. I said, oh, I know somebody by that last name. I went to Calvin with it. Ended up being her father. That was my suite mate at Calvin.
Oh.
I mean, it is
That's
just
Dutch bingo.
Dutch bingo, but
Yeah.
They don't even have to be Dutch.
Yeah,
They're still bingo.
Yeah, that's right. That's exactly right. So yes, the connections and, the importance. And, I think that's what you said, getting to know the person, because some people are very anxious when they go to the dentist, aren't they?
You think?
Yeah. And why is that?
Well, I think a lot of it has to do with those of us who went to the dentist in the olden days. It was scary. It's much different now. And also studies will say the most private part of a person's body is their mouth. Mm-hmm. They're much more fussy on who they let in their mouth to deal with their teeth than to do anything else anywhere else in their body. That might sound strange, but because that's how we identify ourselves pretty much, is from our smile and our mouth. And also, some people gag easily. There's a variety of reasons.
Well, and I think, sometimes when you go to your dentist, it doesn't lie. I mean, if you haven't brushed well, you're not going to be able to fake it. If you haven't flossed, your gums might bleed, correct?
Absolutely. And the longer your teeth are in the mouth, the better the story they tell about you. They tell us whether or not you grind your teeth. Like you said, their gum tissues tell us if they floss or brush, all of those good things.
Well, I'm kind of going off script here a little bit, so thanks. But you mentioned about grinding your teeth. Why do people grind your teeth, and what can you do for it?
People grind their teeth for a lot of reasons. Some of the reasons are where their teeth fit together and where their jaw joints want to be are not in the same place. So they're constantly fighting. Your teeth win out when you're awake and just normal because your muscles take over and move your jaw till your teeth come together so they fit. But where the jaw wants to be is somewhere else. So there's a constant fight. Sometimes we don't know why people grind their teeth. A lot of it does run in families. If mom and dad both grind their teeth, the kids are going to. There's that component. But the biggest component is stress is an aggravator. So anyone who may grind their teeth at all, the more stress they're under, the more they grind their teeth. And I don't know why, Sarah, but in the last year and a half, I have seen weekly several people who come in, they have vague pain. Temperature sensitivity, maybe kind of here, maybe there. It sort of comes and goes. Every single time it's turning out they're just doing more clenching and grinding. So I think as a society right now, we're
under stress.
We're pretty uptight, I guess.
So what do you do if you grind your teeth, if they come into you?
Well, the first thing is to talk about it, and to get them to understand that they actually do.
Right.
And again, that's where your teeth are tattletales, because you can show them the wear patterns,
Right,
and
yeah.
then they say, wow, I never knew I did that. So they do it in their sleep. That's when the most of it happens. I mean, some people clench all day and they know it. But what we can do, step one is we fit them with a custom-made, we call it a bite splint or night guard.
Okay.
It fits over either their top teeth or the bottom teeth. It's smooth, which allows the jaws to go to a comfortable position during the night, and it will wear the plastic instead of their teeth.
Makes sense. Okay, so I mentioned earlier that it's Children's Dental Health Month, and so I want to get an ask.
We have to talk about kids a little, right?
We got to talk about kids a little bit. So the first question I have is, when should a parent take their child for their first visit to the dentist?
Well, this may surprise a lot of people. We used to think what I learned in dental school 40 years ago was when all the baby teeth were in, 2.5, 3, the philosophy now by our current pediatric dentist and all the pediatric dentists in general, they really want to see the child by age 1.
Okay, why? Why that early?
Oh, we always want to know the why.
we do.
We want
do.
to know the why.
Yeah, we do.
The why is, number one, to just have a conversation with the parent about some common do's and don'ts that can really affect the child's oral health. And the other is just to explain to the parent, okay, how do you clean these first teeth that come in? It's important to do that. And also starting to talk about diet a little bit, some do's and don'ts of, like, don't put the kid to bed with a bottle with milk or juice in. Because milk has milk sugar in it, fruit has fruit sugar in, and you're just constantly bathing the teeth in the milk or the juice.
Yeah.
And then the bacteria just use that all night. And we've seen kids with 2 years old with total decay in every tooth in their mouth.
Wow.
So just to get parents on the right foot.
So it's education.
Yep. And also to do a quick check of what's actually going on, making sure everything is normal as it should be at that time.
If you have a question, you may call WHTC at 395-1450. That's 395-1450. My guest is Dr. Brad Dykstra. He's a dentist from Hudsonville, and we're talking about dental health. So I want to talk about baby teeth. Are they important?
They are very important, but I'm going to change the word from baby teeth to primary teeth.
Oh, okay. That's good. Why?
Okay, well, that it's just because the word baby teeth just gives the assumption that they're not valuable.
Okay.
They're not important.
Okay.
But they are totally important for several reasons. One, they're very important for developing proper speech. Number two, they're very important for proper chewing and digestion of food. And the thing most people don't realize is they're very, very important in jaw development and maintaining space for the permanent teeth to come in when the primary, or the other word is deciduous teeth.
Okay.
But they are very, very, very important.
So, what should you do if your child or grandchild loses that primary tooth before it's supposed to come out?
Before it's supposed to come out, generally we don't like to put them back in because that doesn't work well. However, we do usually put in what we call space maintainers. It's something to hold the space, because if you take a baby tooth out early, other teeth start crowding together. There's not room for the permanent tooth to come in. So every baby tooth holds the space for the permanent tooth underneath it.
Is there I've heard somebody say, and maybe this is an old wives' tale, that the longer the baby teeth stay in, the better it is, or, if your child doesn't develop teeth till they're older, it's better. Is there anything to that?
I'm going to say not much.
It's a wives' tale.
There's many old wives' tales.
Okay. So I want to talk a little bit now about dental health for adults. How often should you visit your dentist?
Okay, I'm going to give my own answer. It varies by patient. There are some people that we really should see every month. Mm-hmm. There's some we really need to see every 3 months. There's some, the majority, every 6 months. On rare occasion, we're okay going up to a year. If they're older, they've never had a cavity, we know their oral hygiene is good. But the reason that we want to see them often is because dentistry is still at this point way far ahead of medicine in doing preventive things or catching things before they become a problem. And Sarah, one of the most common things we hear is, why should I go to the dentist? Nothing hurts.
Right.
Because which has been historically the medical model for many people.
Right.
You only go to the doctor if you have a problem. The reality is with our teeth, especially when we take x-rays and we have other even cameras that detect decay before we can see it with our eyes. So we can treat things when it's early. We can be much more conservative, much less expensive for the patient, and the things that we do last much longer than if it gets bad. Because we've seen people that, they had no idea they had decay in their mouth because they hadn't gone for years, nothing hurt. All of a sudden, half their tooth breaks off because decay had gotten in underneath, eaten everything underneath, then the outer shell caves in, and then the decay is into the nerve. Then they need a root canal and a crown, or they lose a tooth. So we want to do things early.
Yes. Okay, you and I, before the show started, I was asking you the question, what about eating candy?
What about eating candy? Well, all right. How much time do we have?
We got about 2 minutes.
All right. I'll keep this short. What's more important than what we eat is how often we eat. So if you're constantly drinking Mountain Dew, if you're constantly eating candy, if you're constantly putting sugar in your coffee and sipping on it all day, you're constantly bathing your teeth in sugar that the bacteria in your mouth make into acid and eat the decay. So I don't care if you had a whole meal of just candy and brushed and flossed right after. Mm-hmm. As far as your teeth are concerned, you're probably going to be okay. Not good for your health.
Right.
Not good for your health. So a little bit of candy here and there, but the worst kind is sticky candy, like the old Slowpoke suckers, that kind of thing, Milk Duds, or like mints that you suck on. Okay, if you just eat a jelly bean and eat it fine, It goes away. But you suck on something for a half hour, curtains.
So do you have any tips that we should heed that will keep our teeth healthy?
Brush and floss daily.
Okay, so how many times should you brush?
Ideally, every time after food goes in your mouth, unless, if you're for a snack, if you're having nuts or carrots, celery, you're okay.
Okay.
But honestly, if you eat a candy bar mid-afternoon and part of it stays between your teeth a long time, you're doing damage. Practically, though, at least in the morning, at least at night.
Right.
So I don't like to make it too hard, but at least twice.
Okay. And flossing.
Flossing at least once a day. We know we need to disturb the film on our teeth. We call it biofilm. We need to stir that up once a day so it doesn't have a chance to colonize.
Yeah. Any other suggestions? What about toothpaste? What kind should you use?
A toothpaste with fluoride in, one that has the seal of the American Dental Association on it, because that means it has gone through the test to show that it is effective.
Okay. And the difference between a regular toothbrush and an electric toothbrush?
Electric toothbrushes, for most people, are really good now, and they do a better job, especially if they use them the 2 minutes as directed. And also, if anybody has any dexterity issues,
Yeah. Oh, it's good.
it's good.
Okay. And we are out of time. Thanks so much for being here, Dr. Dykstra. Until next week, Spectrum Health Zeeland Community Hospital wishes you well. And a reminder from Dr. Dykstra, brush those teeth and what?
And floss.
Floss.
And see your dentist regularly.
And see your dentist regularly.
And thank you, Sarah.
And thank you.
Thanks for listening to Wellspring, presented by Spectrum Health Zeeland Community Hospital on 1450 WHTC and the new 99.7 FM.